going to use electrical stimulation for stimulating skeletal muscle, controlling edemas, facilitating blood flow, alleviating pain, and facilitate tissue healing. Contraindications to it are pregnancy, deep vein thrombosis, cancer, pacemaker or other electrical implants, impaired cognition or impaired sensation. With impaired cognition, that's kind of something you really look for. It's not something that you ask the patient like the other ones. And so today we're going to be using it for skeletal muscle because we had a patient with an ACL reconstruction who was having a hard time getting their muscle to activate. So we're going to try and use that to help facilitate that muscle contraction. All right, so Kenna, how are you doing today?
I'm good.
My name is Alex Kusich. I'm a student physical therapist here at Rocky Mountain University under the guidance of Dr. Clausen, who's on the other side of the phone you're holding. So we're gonna do some ESTIM today, just try and get that quad activated. So we're gonna be sending electrical impulses through you, just to try and help facilitate that motion since we were unable to produce it on your own. So before we get started, I've just got a few questions for you, just to make sure that it's okay that we do this. Are you pregnant? Do you have any sensation impairments, like in your feet or hands? Do you have a pacemaker or any other electrical device installed? And then, do you have DVT or cancer?
No, I don't.
No? All right. So we should be good to go then. All right. So I'm just going to inspect your skin real quick to make sure that we're okay here. And it looks like there's no damage anywhere, so we should be good to go. All right. Make sure those are on there. And then we're just gonna turn this to biphasic. We'll leave it at the 10:30. So it's gonna be on for 10 seconds, and then you'll have a 30-second rest in between the times where it's gonna be activating on you. All right, so when this is gonna be sending those electrical impulses to you, I want you to flex this muscle as hard as you can, and we're just gonna try and get that to move. So we're gonna get you to push your knee down into the table, so your heel might come off the table a little bit, but it shouldn't be too much motion going on. And then we're gonna make sure that our rate is between 50 and 80. So I'm gonna turn you up to 60, 70, because that's was there. And then 200 is fine for that. We got a ramp time of 2 seconds, so it'll start to kick on, and then it'll take like 2 seconds for it to reach its maximum strength. And then we're just gonna get you started. So let me know when you start to feel just like a tingling sensation.
It's tingling.
Okay, so we're gonna keep going up. We want a nice contraction. Can I get you to actually contract this about maybe 50%? Go ahead and kick this leg out if you can. All right, so that right there is what we want this to end up feeling like, okay?
Okay.
All right, so it looks like we're getting a little contraction there. Is that feeling about 50% of the max?
Yeah, that's good.
That's good there? All right. So we're gonna go ahead and get started. And then when that starts, just gonna try and push this knee down into the towel there. All right, and how's that feeling?
Good. It's okay.
No pain with it or anything?
No.
Nope, okay. That's good. All right, so now we got about 25 more seconds of rest, and then we're gonna have that next one come on, and I want you to just hold that for those 10 seconds if you can.
Okay.
All right, there we go. Push that down into the towel. Good job. And then when that's done, just go ahead and relax. All right, I'm just gonna kill it there for the sake of the video. Take these off and make sure your skin is okay. I didn't give you any electrical burns. No, you look good.